Assalamu alaikum. We'll start the long clinical consultation day. Mr. Ali, 70 years, with complaint of short of breath. Okay, we're ready to start.
Yes, start.
Okay. I'll share the timer, then. Okay, here we go. Hello there, I'm Dr. Mukhtar, the doctor in the clinic today. You must be Mr. Ali.
Yes, I am.
You are 70 years.
Correct.
We are here to discuss about your health issue. That's okay for you?
It's all right.
Okay, Mr. Ali, can you tell me what's your complaint?
Yes, I have it breathlessness that I have recently, and it affects my ability to do my exercise.
Sorry to hear about that, Mr. Ali. Can you tell
Yes.
me more about this breathlessness? When it started exactly?
It started for the last couple of weeks, like 3 or 4 weeks, but it keep increasing. Doctor.
Okay, and it started as all of a sudden or
Gradual.
Gradual.
Yeah.
Okay. And you think it's worsening day after day?
Yes.
Okay. Apart from this, you have any cough?
Yes, I have cough. It's a dry cough.
Is it a dry cough?
Yes.
And this cough is the first time ever?
Yeah, no. I have a cough before, doctor.
Okay, can you tell me more about this dry cough?
Yes, doctor, I have this cough for long years, but now it keeps increasing for the last couple of weeks.
Okay. Do you think it's the same cough as before?
I think so.
Okay. Do you cough or did you cough up blood?
No,
Okay. Along with this, you have, or did you hear any noisy breathing over your chest?
no.
Okay. This breathlessness, first time ever, no previous attack?
No, I have breathlessness for the last, say, like 10 years. I have this breathlessness.
The same problem?
Same problem, yes, but now it increases.
Okay. Are you diagnosed by any medical condition?
Yeah. I'm following with a chest doctor, and they told me that I have idiopathic pulmonary fibrosis.
Okay.
Yeah.
And you are taking any medication?
Yeah, doctor, I am taking a list of medication. I'm taking cyclosporin. I'm taking prednisolone. I'm taking bisoprolol. I'm taking amlodipine, omeprazole, simvastatin. Yeah.
Okay. Are you compliant to the medication?
Yes, I am compliant with my medication. And for this lung fibrosis, they did for me a lung transplant.
Okay. And
Yeah.
when it was done?
5 years back.
Okay. Apart from this, you have any medical condition like high blood pressure, high blood sugar,
Yeah, I have a high blood pressure.
and you are taking bisoprolol and amlodipine?
Exactly.
Okay. You have any allergy to any medication?
I think I'm allergic to penicillin.
Okay. Any surgery apart from lung transplant?
No.
Okay. You are frequent on the vaccination.
I am up to date to vaccines.
Okay. Do you smoke, Mr. Ali?
I have never smoked.
Okay. Do you drink alcohol?
No.
Okay. May I know what's your job or previous job?
I was a teacher.
Are you retired?
Yeah, now I'm retired, doctor.
Okay. You are on oxygen at home?
No, doctor.
Okay, back to your history, Mr. Ali. You have any chest pain?
Yes, I have chest pain.
And where exactly?
It's all over my chest. It's something non-specific. Really
Dull
strange.
aching? What the nature of the pain?
It's like aching.
Okay. And
Yes.
if I give you scale from 0, no pain, and 10 is the maximum, can you give me a scale for this pain?
I give it like 5 or 4.
Okay. You're okay now? You want any painkiller?
No, I'm all right. It comes and goes. Comes and goes.
Did you notice a particular thing worse the cough, the chest pain?
Might be the deep breathing.
Okay.
Yeah.
Apart from this, do you notice something worse, your breathlessness?
Doing exercise. Nowadays, even I cannot undress myself. Only my wife come and help me.
Okay, how many pillows you are using while sleep?
Usually I sleep on 1 or 2 pillow, but this is the usual for since I was like a teenager.
Okay, and you notice any swelling over your legs?
Me, I haven't noticed.
Okay. You have any high body temperature?
I have not.
Any lumps or bumps?
No,
Any night sweats?
no.
And how is your appetite?
It's all right.
And your weight?
But I lost weight. Thank you for asking me this. I lost about 5 kilos doctor, around these last couple of months.
Is it intentional?
Not at all.
Okay. And you notice any lumps or bumps? You told me no.
No,
You have any headache,
not at all.
blurring of vision, or problem in the vision?
No,
Any hearing problem? Any hearing problem?
no, no. I'm sorry for that. No hearing
Okay.
problem.
Unsteadiness?
No anesthetics.
Okay. You have any change if your bowel habit?
No, doctor.
Any difficulty of swallowing?
Not really.
Okay. And you have any tummy pain?
No,
Any change of your water work?
no,
You feel thirsty,
no,
passing a lot of water through your water work?
no,
Okay. Any skin rash?
no skin rash.
Any joint problem?
No joint problem.
Any back pain?
No.
Any family history of same problem?
My mother has hypertension. Had hypertension. She passed.
Any lung disease in the family?
No,
Any history of cancer in the family?
no. Actually, yes. My cousin has a has a colon cancer.
Okay. Any travel history recently?
Last travel like 6 years back, I went to Australia and came back.
To Kenya?
To Australia.
Australia.
Mm.
Okay. You have any contact with sick patient or chesty patient?
No, about 6 years back.
Okay. Sorry for this question. You have partner?
Yeah, I have my wife.
Any casual relationship? Sorry for this question.
No. Okay.
Okay. And do you take any recreational drugs before?
No.
Any swift tattooing or piercing,
No.
transfusion, blood
No.
transfusion?
No blood transfusion. I think they gave me when I did the lung transplant.
Okay. And regarding the cyclosporin medication, you are compliant on it.
Yes, I'm compliant. And by the way, I'm taking also co-trimebuxazole.
Okay. May I examine you, Mr. Ali?
Yes, all right.
Okay, first of all, I will check the weight. How is his weight?
Weight is like average.
No cachexia.
No.
Okay. I will ask for vital. How the blood pressure?
All within normal, apart from the respiratory rate around 20.
Pulse rate.
Normal. Like
Any signs?
70 regular.
Any signs of dehydration?
No.
Okay. In the hand, any clubbing?
No clubbing.
Any leukonychia or cholonychia?
No.
In the palm, any pulmonary erythema?
No pulmonary.
Can you extend your arm, your hands? Any tremors?
Yes, there is a fine tremor.
Okay. Any flapping tremors?
No flapping tremor.
Okay. I will examine now for proximal myopathy.
No proximal.
Blood pressure sitting and standing.
No significant change.
In the eye, any jaundice or pallor?
No jaundice or pallor.
No redness as well.
Yes.
Okay, then I will check the mouth for cyanosis.
No cyanosis.
Any gum hypertrophy?
No gum hypertrophy.
Okay. In the neck, any raised GVP? Any signs of heart failure?
No raised GVP.
Any signs of cancer in the neck?
Like
or
like lymph
redness?
node?
Yeah,
No.
any change of the character of the skin?
No.
Any focal area in the skin?
No.
Pigmentation? Okay. I will now examine the chest by inspection for the scar. Is it clamshell scar?
There is a large left lateral thoracic scar.
Okay. Mr. Ali, you have transplant only one kidney, one lung or both lungs?
What you say?
One lung or both lung transplant?
On the left side.
Left side.
Yes.
So I will examine now by inspection the scar. There is left lateral thoracotomy scar, right?
Yes.
Okay. And any over palpation, any tenderness?
No tenderness.
Okay. Now by percussion.
Percussion notes.
Normal.
Normal.
Okay. By expansion, any limited expansion at the back?
No.
Now I will auscultate. Crackles, any crackles or wheezes?
Yes, there is a fine end respiratory crackles at the base of the right lung.
Right lung. And does it clear with cough?
No.
Okay. Any sputum when he cough?
No.
Any surrounding for bronchodilator?
No.
Okay, now I'll examine the lymph node in the neck. Any lymphadenopathy?
No.
No lymphadenopathy.
No.
Okay, any signs of pulmonary hypertension?
Like what you want to see? What you want to
Parasternal heave
examine?
and loud P2.
No palpable or no B2 and no right percent.
Okay, any lower limb edema?
No video.
Okay, you have any pet at home?
I don't have any kind of this.
Any bird?
No, not really.
Okay. May I know what's your concern, Mr. Ali?
I'm really concerning on the transplanted the lung. Is there any wrong with it?
I appreciate your concern, Mr. Ali. We have, before us answer this question, we have to run some work of blood, and also we have to do some imaging to your lungs to confirm that it's nothing affecting it. However, at time being, as long as you have this cough, it might be related to certain infection, and it might be also related to the weak defense system, as you are on some medication for the defense. You have any other concern?
No, doctor, nothing in particular.
Okay, so we'll admit you to run the blood work up and the image, and we'll update you about the management plan.
All right, so what's your clinical finding?
Okay, time is up.
Yes.
Yes, Mr. Ali, 70 years, came with complaint of short of breath, and along with that, he has dry cough. He was diagnosed before with the interstitial pulmonary fibrosis.
He diagnosed with IBF, yes.
And he underwent lung transplant on the left side on immunosuppressant medication, prednisolone and cyclosporin. He's non-hypertensive in bisoprolol, amlodipine,
Yeah.
simvastatin. He's taking Bactrim or cotrimoxazole prophylactic
Yes.
for any infection. And by the examination, he also lost some weight, 5 kilograms over the last months. He's non-smoker. And
what's your clinical finding?
yeah, my clinical finding going with could be due to the cough, or sorry, the short of breath while exercise. So I will put in the differential first of all BCB pneumonia as a complication of immunosuppression and post-lung transplant. It might be recurrence of his disease, interstitial pulmonary fibrosis, or interstitial lung disease. Drug-induced also I can put as a cause of interstitial lung disease. These are my differential.
So how you are going to investigate?
I will admit this patient to run some investigation in the form of baseline basic investigation, CBC, look for anemia, leukocytosis, to rule out any infection, inflammatory markers, CSR, CRP, and ABG I will do also to confirm the hypoxia, PO2, along with the kidney function. As a patient on immunosuppressant cyclosporin, I will do also liver function tests, coagulation profile, of full electrolyte. Then I will do starting by imaging chest X-ray, followed by high resolution CT chest. I will consider also doing pulmonary function test.
If you find on the pulmonary function test obstructive pattern, what's the first thing come to your mind specifically related to this patient?
Yeah, bronchiolitis obliterans, one of the complication of post-lung transplant, either due to viral pneumonia or as a rejection of the transplanted lung.
All right. Then next question is, if you find like this obstructive defect, what would be your next step in the management of this patient?
Yes, after confirming no infection by I mean blood test, I could think about BAL, bronchoalveolar lavage, to get sputum for culture and sensitivity, along with gram stain and fungal stain for BCB pneumonia. Then I could start him on antibiotics, broad spectrum antibiotics, as he is immunosuppressed after taking the culture.
All right. Then another question is, this patient has a loss of weight. What the first thing that you are thinking of?
Yeah, cancer step on the differential, the top of the differential as the patient immunosuppressed or on immunosuppressant medication.
All right. Then what else? Could this patient have a developed pulmonary hypertension?
I couldn't appreciate any signs of pulmonary hypertension in the form of
Could
paracetam
this
anemia.
patient have developed pulmonary hypertension?
Yeah, I couldn't appreciate the finding of or signs of pulmonary
Hello?
hypertension. Yes. Yes, Dr. Roda, I'm talking. You can hear me.
Yeah. All right.
Yeah. I couldn't
couldn't hear you.
appreciate any finding or signs of pulmonary hypertension in the form of right side parasternal heave or loud P2. So I can't, I need to do echo to confirm the pulmonary pressure, pulmonary artery pressure.
All right. Well done. You did it very well, really. This is only a case for differential, not for anything else. It could be like the differential in addition to what you said. It could be like the worsening of the pulmonary fibrosis affecting the other lung, or it could be like anemia. So you have to, you did it in the examination, and you may ask if he has like any blood loss from the rectum or something. It could be a pulmonary hypertension, not secondary to hypoxia because he's not hypoxic. It could be secondary to chronic thromboembolism, or he has like a hidden connective tissue disease. It could be like lymphoma, secondary to his immunosuppression. And good you that you did an examination of the lymph node and you did ask about trash and examine the skin thoroughly. It could be he has on ischemic heart disease, atypical presentation, especially he is an elderly on immunosuppression and he has a background history of hypertension. Or it could be like beside this anemia, lung fibrosis, or it could be like chronic lung transplant rejection, especially if he has like infected with a cytomegalovirus or something. That we should like investigate further and refer him to the transplant team. It could be like infection, not only by the cytomegalovirus, Epstein-Barr virus, BCB, although he's taking his prophylaxis, which is the cotrimazole. It's only a case for differential, but you did it very well.
Okay, thank you, Dr. Roda. Nice
Well,
case. Thank you so much.
welcome.
Yeah, good preparation for the case, and yeah, it's complicated case. Thank you all again for the case. Any comment from others? Bronchiolitis obliterans, yes, one of the differential. However, no signs of, no wheezes to say this is bronchiolitis obliterans. At least you will have wheezes on the chest by examination. Sorry? Any comment, any question?
What is the difference يعني in the history and in examination يعني you get my question يعني how I know this bronchiolitis obliterans except complication of post transplant any
Yes.
clue
The clue will be in the examination. You will have wheezes, and you can ask him specifically in the question, do you have any noisy breathing? So this is by history and by examination. Then in the investigation, you will have obstructive pattern in the pulmonary function test.
Yes.
Okay.
Thank you.
Yeah, most welcome. Thank you,
Nice
Dr. Hunaida.
present.
Yeah, it's a nice case, and by Dr. Roda. Thank you, Dr. Hunaida, for your comment, and Dr. Roda. Any comment? Dr. Hunaida, you want to comment on the case? Okay, any question before moving to the second scenario? Mr. John, 55 years. With complaint, of Dr. Rhoda, your case, Mr. John,
Yes, 55-year-old.
55.
Yes, complain of drooping of eyelid.
Yes.
2 minutes.
Okay, take 2 minutes, then we'll start.
Yes, we can start.
Okay, with just a timer.
All right.
Yes,
Hello
you.
again. I'm Dr. Zain, one of the doctor covering the service today. Am I
Mhm.
talking to Mr. John, 55-year-old?
Yes, I am.
Mr. John, we are here to discuss issue related to your health. After that, I will examine you and will address your concern, all right?
Mm-hmm.
So tell me what the problem.
Doctor, I can't see by my eyes now.
Hmm. Hmm. May you like elaborate more what you mean?
Yeah, doctor, because I think something covering my eye.
Mm, mm, mm. Um, uh, is this for how long?
This started all of a sudden since 1 week now.
1 week. Does this happen to with you before?
No, first time ever.
Is it both eye or one eye?
No, doctor, one eye.
Which one?
The right one.
The right one. And with this, do you have any headache?
No,
All right. What about your vision in itself? Like if there is no sun covering, if your eyelid is not like covered, do you have a problem with your vision?
no,
Do you see double?
no,
All right, all right. And no pain at your eye.
no,
Is this associated with any specific timing of the day, like end of the day?
no, doctor.
All right,
All
all
the
right.
day.
All right. Is there anything improve this?
No, doctor, I have to pull it up by my finger.
So nothing, like anything you notice that like
No,
worsened it? All right, all right. Then I would like to ask you, do you have any problem with your gait?
no, doctor.
Any weakness?
No, doctor.
Any pins and needles?
No,
Any slurred speech?
no,
All right. Do you have like any fits?
no,
All right. Do you have a problem with walking up the stairs or combing your hair?
no, doctor.
So, on background of your medical history, do you have things that you want to tell me that I should be aware?
I don't have, doctor.
All right. Do you have like any trauma to your neck, your axilla,
No, doctor.
or head?
No,
Do you have you done any kind of surgery
no, doctor.
or any intervention like for your heart or something?
No,
No. All right. Any admission?
no.
All right. Then I would like to ask you further question you may think that are not related, but they will help me a lot. Do you have any change in your weight?
Yes, doctor.
Have you lost or gained?
No, I lost, doctor, about 5 kilograms for the last 6 months.
Was it intentional?
No, doctor, at all.
And do you have any change in your appetite?
Yeah, doctor, I noticed my appetite is not that much that as before.
I'm really sorry for that. Do you have increase in your body temperature?
Sometimes, doctor, I have increased the body temperature.
When exactly? Is it related to the night or all the day?
Yeah, I notice the night, as well as my sheets being wet over the night.
Like you are sweaty.
Yeah, doctor.
Do you have any chills or rider with it?
No.
Have you checked it?
38, doctor.
38. All right, all right. And do you have like any itchiness in your body?
No.
Lump or bump?
Yes, doctor. I
Where
feel
exactly?
some in the neck, some under my armpit.
Some in your neck and where?
Armpit, under the armpit.
Your armpit. All right, all right. Then I would like to ask you, do you have any cough?
Yes, doctor.
Coughing or blood?
It was before no blood, but yes, you're right, doctor. I noticed in the last 2 weeks there is some blood coming out.
What about the amount?
It was just tinged with blood before, but now I noticed the tissue being more bloody.
Do you have any shortness of breath with it?
No,
Any noisy breathing?
no,
All right. And do you have any dizziness with this coughing of blood
no,
or heart racing,
no,
chest pain?
no,
Do you have any leg swelling?
no.
How many pillows you still on?
Still, I'm using one pillow, doctor.
All right. And do you have any joint pain?
No,
Do you have any rash?
no,
All right. Do you have any problem with your water work?
no,
Do you have bleeding coming from any orifice?
no,
A bruising in your skin?
no.
What about your bowel habit?
It's the same, doctor, no change.
Any difficulty with swallowing?
No, doctor, I have no difficult swallowing. If you ask me, doctor, about my bowel habits, right? Yeah, I
Yeah,
notice
about your bowel habit, yeah.
I notice it being more hard than before.
And what's the usual for you?
My usual was like every day, but now every other day, or sometime every third day.
Do you have any mood changes?
Uh, I'm worried only, doctor. So yes, I notice like my mood is not that before.
Because you are worried.
Yes, and also I feel low mood nowadays.
Do you have any bone pain?
Sometimes, doctor.
All right. Then I would like to ask you, do you have a family history of cancer?
Yes, my father was having cancer in the colon.
Mm. Mm, mm, mm.
Yeah, and mother also with the cancer of the breast.
Mm, mm, mm. All right. And does this change in your bowel motion? Is it like sometimes like loose motion, then time and hard motion, and that's it, and like this?
No, always
And no
hard.
bleeding, and no bleeding, and from your back passage,
No,
tummy pain.
sometimes I have tummy pain in the sides.
No, all right. Then I would like to ask you, show me your medication list.
Uh, Nothing, just a painkiller when I have any pain in my bone.
All right. And are you allergy to medication?
No, doctor, I don't have any allergy.
Are you on any illicit?
No,
I would
never.
like to examine you. During examining you, I may ask you further question. What about the like the body build of the patient?
Yeah, he looks like little cachectic.
Vitals,
Vitals okay. Blood
right?
pressure 100 over 60. Pulse rate is 80. Saturation is 94 on room air.
All right. And then I would like to see the hands. Any clubbing or leukoplakia?
Yeah, there is clubbing.
Any wasting of the hand muscles?
No, preserved.
Reserved. Then I would like to see for any pulmonary edema or tar staining.
Yeah, there is star stain.
Do you smoke?
Yes, doctor, I am.
For how long and how much?
For 40 years, doctor, I'm smoking around 10 to 15 cigarettes per day.
Smoking is hazardous for people who have especially in your condition. I'm advising you to stop smoking. Do you think you can do it?
I will try, doctor.
Okay, thank you. Do you drink much alcohol?
Socially only.
All right, all right. Then I will go for the. Do you have any? You said no joint pain. Pulmonary edema.
No,
Then
no pulmonary.
yeah, I will check for crabbing tremor.
No flapping tremor.
Yeah. Then I will go. I tell the patient to cough. Is there any productive cough?
Yeah, it seems productive, but no sputum now.
Sometimes you have this productive cough. Is it only for blood or with something else, Mr. John?
Yeah,
Like it come like with a green color, something, any change in the color?
no. It's like white one, but recently being bloody.
Do you have any history of asthma or any
No,
problem with your
doctor.
chest? Or admission because of your chest?
No,
And you are not on like a wheezy chest, always noisy breathing, I mean.
no.
All right, then I will go for check the pulse, regular volume.
Yes, pulse is okay. Regular, no special character in the pulse.
I will do the water hammer pulse. and I will do for proximal myopathy. Check the
No.
eye for any pallor, and I will go for the eye. It has a drooping, I think, the right side, you said.
Yes.
Yes, and I will, it's on only one side. Then I will check the pupil. Is it deviated or something?
Yes, pupil in the right side constricted 1 millimeter. In the
Yes.
left side 2.5 millimeter. Both
Okay.
are reactive.
Is it deviated or something when I do the hand movement?
No.
No. All right, and then I will check for the visual field. I
Yes.
will, yes,
Normal visual field, no affection.
acuity,
Acuity normal.
acuity normal. Then what else? Then I will, do you have any problem with sensation in your face or your chest? In the sweating, I mean.
Yeah, doctor, I notice my face, especially the right side, dry compared to the left.
Right. All right, all right. Then I will do rest of the cranial nerves examination. You say the hand movement is normal, am I right?
Normal. All other cranial nerves examination normal.
Normal. Then I will go for the neck, any scar, lymph node, raise JVB.
Yes, no raised GVB, but there is lymph node cervical and axillary,
In the
bulbable.
axilla. Also, is there any scar in the axilla?
No scar?
Is there any change in the voice of the patient?
No.
I will examine the chest. I will auscultate. Any added sound?
All over the chest, no added sound, apart from right apical bronchial breathing.
What about percussion?
Yes, resonant all over, apart from the right apical.
It's
Dull.
like dull, right?
Yes.
And what about the expansion?
Normal expansion,
A trachea shifted or not?
not shifted.
Not shifted. All right, and then I will check for the sacral edema.
No sacral edema. 2 minutes remaining.
Okay, and I will check for the lower limb edema.
No lower limb edema.
All right, then what's your concern?
What I have, doctor, is it cancer?
Actually, I do really appreciate your concern, Mr. John. First, after assessing you, I'm afraid, and I'm really sorry that cancer of the lung is a probability that need to be ruled out. Putting in mind your smoking history, your age, and this coughing blood.
Okay. So why my eyes like this, doctor? Is it something serious in the eye?
Yeah, thank you for reminding me, the issue is you came with this drooping of your eyelid. We call it a Horner syndrome. Don't bother yourself with the term. It's when there is a medical term for a condition with the compression of the nerves supplying the eyelid and running around the neck and lung. It could be compressed by something. It could be like growth, like due to infection, or I'm afraid to tell you that it could be like a tumor. What we need to do now, we are going to admit you. We will run some blood tests and imaging. We will involve the chest doctor. And yes, and specialized nurse. Meanwhile, we need from you to stop smoking. Do you have any other concern?
Will you admit me, doctor?
Yes, you deserve admission for further work. Do you have any other concern?
No, doctor.
With whom do you live?
With my partner.
And what do you do for a living?
Yeah, time is up. Perfect, you remember the job, but it's okay if it's late, but supposed to ask earlier.
All right.
Okay. Yeah, good job, Dr. Rhoda. Let's go to the examiner. Present your case, please.
And this is Mr. John, 55-year-old, presented with drooping of his right eyelid. that affect his vision, this drooping, and associated with this, he felt along his neck and axilla. Also, he has like associated coughing up of blood recently, and he has a family history of cancer. Besides, he has a change in his bowel motion and mood. On examination, mhm, I think he had a clubbing. There is no wasting of the hand muscles and no proximal myopathy. But in the eye, there is a drooping in the right eyelid. He gave a history of dryness in his face. And also the right pupil was constricted. Also, he had like no anemia, and he had lymphadenopathy in his right axilla, I think, and his scattered around his neck, no scars. On examination of the chest, there is a dullness on percussion and bronchial breathing in the right apex, and this is the presentation.
What do you think this patient have? I mean, the underlying, give me differential, 3 differential.
All right, this patient has a right-sided corner syndrome for differential. And I think it is in the middle ganglionic area. It could be related to primary cancer in the lung, like a squamous cell carcinoma of the lung, or it could be secondary to metastasis from his colon. That this change in bowel habit is not related to the calcium, but the primary in the colon. Also, other differential, it could be like if he had like any trauma in the lung, in the axilla, I think, or neck, although I couldn't appreciate in the history on examination. Or it could be like any like intervention to the great arteries and veins in the neck, but he denied this. Yes, this, or it could be like, I think, cervical rib.
Okay, you mentioned squamous cell carcinoma. Why you suggest that squamous cell carcinoma?
First of all, he's a smoker for more than 40 years. His age, coughing up of blood. He has a signs of hypercalcemia. And also this Horner syndrome, all of this going with this squamous cell carcinoma, especially that it affects more, I think, to the center more than the periphery, I think so.
Yeah. Okay, how you investigate this patient?
We'll investigate this patient thoroughly, apart from the basic lab, including full blood count, looking for any anemia and inflammatory markers to see if there is any kind of infection. I will take also renal function test, liver function test, clotting profile, and Marabone profile. We'll do also a chest X-ray and a high resolution CT scan of the lung. What I will,
Why you want to do bone profile?
I would like to see the calcium in specific
And
and
did you,
AMD.
what's your
Yeah.
expectation?
It will be high.
Mhm.
Yes.
Why
Yes.
calcium be high in this patient?
Because it's a paraneoplastic, these hypercalcemia, because of the release of the parathyroid hormone releasing peptide. I think.
Excellent. Okay. Okay, go ahead. And the image you said?
Yes, we'll do a chest X-ray for the lung and a high resolution CT scan for the lung. And further, I will follow it. If there is anything in the lung, I will follow it with a band CT, looking for the staging. And also, I will do stool general.
Any other study you want to do apart from pan CT?
In this patient, PET scan.
Excellent. Yes.
Yes.
Okay. If you have mass, what you will do?
This will be decided by a multidisciplinary team headed by the chest consultant. we may follow it by bronchoscopy or even lung biopsy to see exactly what is the type of the mass. That will also see its size, and also we will do a band CT scan for staging, and then the management will be according to the type of the tumor.
Okay. If you have early stage of the cancer, what's your management?
If this is runs to be a squamous cell carcinoma and early, it will be mainly surgical because people coming with non-small cell cancer usually come early. So it will be surgical plus or minus, mainly surgical. So we will include the surgery, the thoracic surgery too.
Okay.
Yes.
And for the hypercalcemia, how you manage it?
Yes, for the hypercalcemia, we'll see the we'll see if the patient first by the ABCDE. He will see if he is dehydrated, if there is a blood pressure sitting and standing, urine output chart, ECG. He need a hydration. And beside, we can give, I think, a medication in the form of like a bisphosphonate or a calcitonine. You think so?
What about diuretics after hydration?
If this patient like well hydrated, and yeah, there it
Yeah.
can be
So
like
one
a
of
rule
the
for
management, one of the line of the management is to give diuretics. It
All
helps.
right. All right.
Okay.
All right.
Any role for dialysis in hypercalcemia and resistant hypercalcemia?
Really, I don't know, but yes, it might be.
Yeah, there is role. Okay. Okay, thank you, Dr. Roda. You did the case.
Welcome.
You catch the diagnosis. Yes, this is a case of Horner syndrome, complicated squamous cell carcinoma, or what's called Banco's tumor. Based on the long history of smoking, heavy smoker, and he came with the ptosis on examination. There is meiosis, as you said, and anhidrosis by the history or by examination. Apart from this, he coughed up blood recently, and there is also a clubbing in the examination, tar staining or nicotine staining. All this going with squamous cell carcinoma. We will conclude that by doing investigation and image. Okay, commenting on performance, you did great. You start to think about the CNS causes because you ask about the CNS symptoms first, the vision, the double vision, the pain, the speed, the pins and needles, trauma. Trauma here also very important, either to the neck or to the eye. And you ask both questions. Then the gait and speech, all these questions thinking about something central. You can also add to them TIA or stroke in case you have central Horner due to, stroke. Since this patient is not having any risk factor, so it's out, and neurological deficit in this patient. You cover all the system review. Of course, you will have some paraneoplastic syndrome symptoms. In this patient, he has hypercalcemia, so you will have the sign and symptoms of hypercalcemia, starting by the headache or the mood, bone pain, or thirsty. You can ask us about feeling thirsty, polyuria, polydipsia, and polyuria. Then the constipation. Okay. The other thing here, the constitutional symptoms, very important. Loss of weight, the appetite as well, and the lumps or bumps. And you found it in the lymphadenopathy in the examination. So this is the clue for cancer or lung cancer. Apart from the social history, family you ask, Travel, you didn't ask. Medical history, you ask about allergy, surgery, any trauma, any procedure, even. All these questions were okay. HIV, I think also you have to ask quickly about any risk of HIV. The thing you miss here, the job, because some occupational cancers, I mean, and the most important as well, the driving. If the patient is driving and he's having ptosis, whenever we have complaint of something affecting the vision or the eye, please write the driving in your paper, because whenever or whatever you are doing, you will miss the driving. So please, this only symptom or these symptoms you have to ask about driving, which are related to the eye. Any eye complaint, you have to ask about driving. Okay. Examination, you did it great, Dr. Roda. From the hand, clubbing, tremors, nicotine staining, then examining the eye itself for ptosis. And the ptosis, you will examine from which side? From above or from the side or front? From the front, you will see it's covering the upper palpebral fissure of the eye, right? It's touching the iris. This is for the ptosis. Meiosis, as you did by the torch, flashlight, then the field and acuity you can offer. However, everything will be normal. Apart from this, the examination of the chest, apical lesion by inspection, by palpation. Sometimes expansion might be affected if there is collapse, and by auscultation, bronchial breathing as any cavity, along with the dullness, and tactile fremitus as well. The differential in this patient, as Dr. Rodas did, Horner syndrome, trauma, or cervical rib. But you have to mention Horner syndrome because of a pancreas tumor in this patient. But our differential here for the complaint. Okay. Any question or any comment for this patient or this scenario?
No, nice presentation. Small cell cancer can cause Horner or
Any
not?
cancer. The idea is growing cancer and compressing over the sympathetic chain. So it can be.
I think
Okay.
pancreas tumor.
Sorry.
Pancreas tumor of the apical of the lung.
Pancreas
Bunker.
tumor, the term of apical tumor. It's not specific for a type of cancer.
Yes.
Yes.
So small cell or whatever the cancer is, it might be pancreas. But the common is the non-smalls, especially for the smoker. They are more common, and the adeno and non-smoker. By the way, in a small cell lung cancer, 20% of the incidence. The others for non-small cell. And this is good also for the patient because small cell lung cancer, whenever discovered, it will be late. And it will be like advanced and spread already, metastasized. And the management will be like palliative. The squamous or non-small will be early discovered, and it might fit and amenable for surgery. Okay. Any other? Yes.
Thank you so much. Nice case. Nice cases. I have so regarding the Horner, it's actually a complex topic and difficult to remember. Yeah, if that is okay, and if it is ready, can we discuss what about the differential diagnosis and how to according to the according to the anhydrosis that is available in the case. So there is a differential about the causes of the Horner and whether it is present anhydrosis, absent anhydrosis, or all over anhydrosis. And any easy way to remember them?
Yeah, I
Thank you.
remember mnemonic was STC. Yeah.
سنترال وبري جانجليونيك وبوست جانجليونيك. السنترال دي في السي ان اس طبعا هيكون حاجة الاستراك الاماس التي
Yes.
اي اي زي ما قال غير الدكتور، يعني حاجات كلها في السي ان اس. صح؟ لو غلط صلحوني يا جماعة، الكلام ده نسينا في
Yes,
وين.
yes, yeah, you're right. Go ahead.
البوست البري قصدي سوري البري دي اللي بيكون فيها انهيدروزس. السنترال بيكون انهيدروزس في الفيس والترانك
البادي يعني. Yes,
والترانك.
all the body.
اما
Yes.
اللي بعدها البري دي بيكون فيها انهيدروزس في الفيس بس. ده اللي هم منهم اللي قلتوا مثل البانكوست تيومر
Mm-hmm.
والسيرفايكال ريب. هم
Mm-hmm.
حرف البي، حاجات الحرف البي معاهم بس الواحد المحشورة في النص هي السيرفايكال ريب، مع انها بالسي المفروض تكون مع البوست لكن لا هنا جاية مع البري. عندك البانكوس تيومر والباروتيد تيومر. تاني شنو كان؟ البي الثالثة شنو
Trauma.
كانوا؟
Trauma.
ثيرودكتومي
تروما.
ثيرودكتومي
Two.
أيوة
It was STC, doctor. I remember STC.
أيوة تي.
T, not
التي
B.
معاه
Yes.
التي الوحيدة الخاربة النظام.
Yeah, T.
عندك كمان
Tumor.
ثيرودكتومي وتروما.
هي البسي كلهم بسي الكلاستر هذيك. والكاروتيد حاجات الكاروتيد كاروتيد تيومر كاروتيد ستينوزيس أظن حاجات كلها بالسي. لاحظتوا كاروتيد 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 فيها 3 كاروتيد ومعاهم كلاستر هيدك ومعاهم شنو تاني يا جماعة؟ ذكروني.
This is for what? This post?
وما بكون فيها انهيدروزس. نو
This
انهيدروزس.
is the post, right? Yes. Yeah.
دي البوست.
No
ايوه ما
anhydrosis. Yes.
ايوه لانه طلعت خلاص من مرحلة الجانجليونيك
Yes,
بريم.
exactly. So
لكن
STC is for stroke.
بتصيرون في الجروب لانه صراحة في النص ده ما
Mhm.
ذكرته.
طب معلش
T
عشان
T.
انا جاي متاخر يا جماعه لو سمحت، ازاي بنسال على الهيدروزس؟ is there any problem in the sweating؟
Yes.
بس كده.
You notice, yeah, any change in the sweating in your face, asymmetry, dryness. Okay, let's remind again. STC. S for central stroke. T for tumor, preganglionic tumor, and trauma.
بص
And
ثيرودكتومي.
yeah, was thyroidectomy
أيوة.
also. Trauma still T also. And the last is C for carotid body or carotid injury like that. STC. This is what I remember also from part 2.
بس السيرفايكال ريب بالسي عشان الشخص ما يتغشى ما حتكون مع الكاروتيد والهناي
Yeah, this
والكلاستر
is
هنا
with the
أيوة.
pre.
مع البري.
Mhm.
معلش هو
ايوه
احنا ازاي بنسال على السيرفايكال ريب؟
ايوه
Exam
عشان تحضر الريب قريبة قريبة من
ازاي
اللنج
تسالي
اللي هي
عنها؟ ازاي تسالي عنها؟
examination,
يعني ايه الاسئله
doctor,
دي؟
by
ده
examination.
اكزامينيشن.
Unless he
ماشي.
did some scan and he found it and someone told him
ايوه
about. Or he presented with some tingling in the hand or pain at the neck.
تقريبا رينود فينومينا صح؟ رينود بتيجي برينود
Raynaud,
برضه.
yes, it might be cause of cervical rib can cause Raynaud's secondary by vascular injury or by vascular compression. Yes, good discussion. Thank you, Dr. Abdullah, for this question.
ان شاء الله
Yes,
هشير الورقه اللي هي فيها
yes, okay,
خدها
please.
سكرين شوت وهشيرها ان شاء الله.
Thank you.
إن شاء الله.
Thank you, Dr. Shaima. Thank you, Dr. Roda. Thank you for the comments, Dr. Hadil. And Zoom. Yes, biopsy. We have to do biopsy for any suspected mass or cancer. After doing staging, you have to do biopsy to confirm the type of cancer. Okay. If the mass is central, you can do bronchoalveolar. If peripheral, you can do CT guided or radiological guided. If you have lymph node, you can take lymph node biopsy. And if you have pleural effusion complicating, you can take pleural analysis or the pleural fluid for analysis, cytology. Okay, these are our case today. If no more question and comment, we will end this session. Thank you all for participating today and sharing. See you tomorrow, inshallah, with the communication day. Assalamu alaikum wa rahmatullahi wa barakatuh. Good night.